welcome back to Embracing Health. Today we're going to talk about a typical acupuncture treatment. Before we get started, I just wanted to talk to you about what theories lie behind an acupuncture treatment and how we come up with a diagnosis. First of all, there are a few things that we look for and we concentrate on, and one being qi. If you've ever heard of it, it runs through meridians in our body, and whenever we put a needle into a specific point, that is hitting a point on a meridian or a channel in which the qi runs through. So we have a lot of different points on the body as well as the ear. As you can see, all the meridians running along the body and every individual point along each channel, and that's what we're tapping into is the qi. There's also blood that we pay attention to, and then we also concentrate on essence, and that is something that we get from our parents and we get from our environment, and we're constantly trying to balance and tonify. And then lastly, we do focus on spirit or shen, and that is kind of based in psycho-emotional disorders. So those are the four main things that we focus on. Now we also do focus on organs in the body: the liver and gallbladder, the heart and the pericardium, the small intestine and large intestine, the spleen and stomach, the kidney and the bladder, the lungs, and what we call the sanjiao. Now the sanjiao, it's this energy that runs through your torso, and there's three different jiao: an upper jiao, a middle jiao, and a lower jiao. All of the other organs are situated in the different jiao. So we do count the sanjiao as a separate entity and a separate organ. So with that, when we're doing a typical diagnosis, we will be asking 1,000,001 questions that might not even have anything to do with the main complaint, but they let us know a little bit more about what's going on in the body as a whole. Everybody is different. So for example, if somebody were to have knee pain, I would ask if they've ever had a traumatic incident, if you had arthritis, and some people just develop knee pain on its own. If your main complaint comes up as knee pain, I might still ask you about your sleep. How's your digestion? And it may not seem to have anything to do with that knee, but I'm really trying to get down to what is the source cause of that knee pain. Now, the biggest thing that we look at for diagnosis before we ask any of those questions is your tongue, and we feel for the pulse. Everybody's tongue is different coloring, coating, size and shape. That all tells us different things about what's going on inside. And the pulse on each hand will also tell us different things. There are 3 different positions and 3 different levels. Both sides actually have different organs pertaining to each pulse. But the quality of the pulse is also a factor we take into consideration. So many different things we look for and we feel for or we listen for just to better diagnose our patients. And if those things change, we might change the treatment and really treat according to your pattern. So that's what you guys can expect. We will now show you a typical intake. For the purposes of this video, we'll cut it very, very short, but in the meantime, enjoy what it looks like for a typical treatment. any more questions, sound off below in comments. Email me at acupunct17@gmail.com. In a future video, I will also discuss more about Chinese medical theory. All right, thanks you guys. Bye.